Welcome to Inside the Skev COVID edition. I'm Aaron Masliansky, and today I'm joined by Manya Treece. And Manya just started an organization called Community Counter. So Community Counter is an organization that is helping with the Orthodox Jewish community with counting COVID cases. Manya is going to tell us all about it and how it translates into the general population and how it can really help a lot of people. And it's brand new. And Manya, I really appreciate you joining and telling me about it. So thanks for being here.
Thank you so much for having me. I really appreciate it.
It's a pleasure. So, this is an interesting concept. And, one of the questions you may think is, why do we need this? Or what gave you the inspiration to do this? So tell us a little bit about the backstory.
So the backstory really just begins with the fact that I myself am high risk and have been very interested in figuring out ways to keep the specific community that I am in safe. So it starts with a little bit of that. But the next impetus for it was really learning a lot about contact tracing, as I've sort of been doing a deep dive into COVID stuff, as a lot of us have. I think that's something called doom scrolling, when we're all clicking refresh on our Facebook feeds. And I've been just interested in learning about mitigation measures. So I started to hear about something called hyperlocal contact tracing. And I thought about my hyperlocal community, which is the Orthodox community in Skokie, and how permeable the boundaries are between the local Orthodox community in Skokie and Orthodox communities in West Rogers Park, Peterson Park, Lincolnwood, and to some extent even Lakeview. And I looked at some stuff that was coming out of the Chicago Public Health Department about this concept of hyperlocal tracing. And I thought, one interesting thing about the Jewish community is that at the times when we are most socially engaged, we are not with our phones. So a lot of the new developments in contact tracing that are app-based and phone-based are probably not helpful to a lot of Orthodox Jews who might be meeting for Shabbos meals or holiday things, or at minyans over the course of Shabbat. And so I wanted to figure out a way that we could see the trends within the Jewish community that are specific to the Orthodox community, because I think we are uniquely dense. We congregate together. We are living within an eruv, so we are geographically proximate to each other. We frequent a lot of the same simchas. We frequent a lot of the same grocery stores and school functions. And so because we are dense and because we are so intertwined on a very sort of geographic and physical level, but because this contact tracing technology doesn't necessarily meet our needs, I thought, what could be a system for us to know specifically what's going on in our communities? And my first phone calls were to the public health departments. And they acknowledged that one of the issues that they have is that they are not able to tell a specific community where their trends are heading. You can see by zip code, you can see by region what's going on, but it doesn't tell you specifically where the numbers or the outbreaks or the clusters are coming from. So even though here in Skokie, I live in 60076, I might be in a position to see that there has been an uptick or a downtick even in cases, but I won't know where those cases are coming from. And I would like to know where they're coming from relative to my hyperlocal community, so that I can make my own, more informed risk calculus about whether or not I want to send my kids to school, if I'm going to have my groceries delivered or go to the grocery store, things like that. So that's where the concept originated, was to be able to tell what the trends were a little bit more on a more micro level than what the zip code information can give us through the health departments, and to see if others would be interested in that information, both on individual level and on a communal level, so that our leadership and our rabbis have a slightly more precise understanding of what's going on in the community, so that they can make informed choices for the communal institutions that they lead.
And one of the reasons why, if you're not in a more insular community or familiar with, Orthodox community, and what you talk about, that, you're not using your phone on certain days. So, Friday night to Saturday night, you can't use any electronics, and certain holidays, Rosh Hashanah, Yom Kippur, different things like that. People are not using their technology. And on top of that, in a typical year, you may have people congregating for prayer services at least every Saturday morning. And in some places, there may be hundreds of people. And then on Rosh Hashanah or Yom Kippur, you may have 1,000 families in one building, and you're literally there all day long. So when we talk about why it's so important that you have to know in your hyper local community, if you're not in that community, you may not be going in and out of those places where you're in a confined space with a lot of people.
Right.
But if you are, you definitely need to have the real-time data.
Mm-hmm.
Right?
Exactly. And I have learned along the way that really all public health is hyperlocal. And if you look at how, COVID has spread, it's in very small clusters that sort of just explode. So the whole concept of being very local is actually relevant to the public health sphere, I think, across the board.
Yeah. So what exactly do you do that's different than say the Skokie Public Health Department?
So we are really limited in our scope to see what's going on in the Jewish communal sphere. And that's both informal gatherings and formal gatherings. And the concept is we're trying to marry the fact that COVID, unfortunately, carries a lot of stigma. And so people might not be willing to report to individuals within their own community that they have tested positive for COVID. And so we're trying to marry this concern about protecting people's anonymity, accounting for the fact that unfortunately there is this stigma, and also the need for people to inform individuals who they may have been in contact with that there is the potential for them to have been exposed. And unfortunately, also with COVID, we know that exposure can begin several days before symptoms appear. So what we are doing is we are asking people without any identifying information to let us know the date of their test, and 2 days prior to their first symptom, up until they go into isolation, presumably that is the point at which they get their test results, where they have been within the Jewish sphere. So we're not necessarily interested in what office building you were in or where you got your hair cut or even necessarily which grocery store you were in. We are specifically interested in things like weddings, funerals, services at a synagogue, meals. Aaron, maybe you can explain what Sheva Bracha is.
Yeah.
It's, the kind of like meals that follow a wedding, specific things that are sort of relevant in a daily way to Jewish life, where people will congregate. And unfortunately, even if people take a lot of precautions, it's not it's not a full perfect solution. So it's important to get information out there when people have been exposed in a fast and precise way. And we wanted to allow people to do that and to inform their neighbors and their loved ones without necessarily needing to identify themselves so that they feel comfortable sharing this information.
Have you heard of instances where when people share the information that they have COVID, that there's a backlash towards them?
Unfortunately, I have. I'm not going to go into specifics because I want to, protect the people who
Sure.
who have experienced that unfortunate outcome. But I do know that sometimes when people have identified themselves, and my professional background is as a psychotherapist, so I understand the psychology here. I think people get very, very frightened, and that fear turns into anger. And a lot of times they, express that anger to the people who have tested positive because in their minds, these are people who have put them at risk. While it might be true that they've put them at risk, it's generally inadvertent, and that is what is so sneaky about this illness. So we are trying to prevent any backlash from happening with this system.
Right. It's almost like telling people that you have an STD and you have to go back and tell every partner that you've had.
It has a lot of parallels. Unfortunately, it has a lot of parallels to STDs and the beginnings of the HIV and AIDS crisis, in the sense that when people identify that they have this disease, there is a sense that they have failed, that they have not been responsible, that there is a sort of moral hazard in acknowledging that this has happened to them or to somebody in their household. And I think that's really unfortunate because it gets in the way of contact tracing and of people being really transparent with each other. But unfortunately, that is the case, and people have a perception about irresponsibility being at the heart of transmission. And so we are just trying to solve for that and protect our community.
Yeah. Who is actually doing the work for your organization?
So we are working under the auspices of a Jewish organization in West Rogers Park called Refuge 311. And they are a health organization that connects people with resources who may be in medical crises. And so it was kind of a perfect fit for them to be the umbrella for the contact tracers that are a volunteer team of folks. They have all trained using the Johns Hopkins course on contact tracing. They've all signed non-disclosure agreements indicating that they will not share anything that they learn with anyone outside of this volunteer endeavor. And they are generally folks who are nurses or social workers or who have some professional background in being able to deliver sensitive information to people in a way that is both compassionate but fully informative. So Refuah 311 is housing these people. They have applied, we have screened them, they have done the course, and they're a wonderful crew of folks.
Yeah. And how many people are there? Are you looking for more volunteers?
I think at this point we could definitely use a few more volunteers. I mean, it's hard to say. Obviously, our hope is that the site never has to get used. So currently, we have 5 contact tracers who are on board and registered and ready to go. Unfortunately, with and the potential for an uptick in the fall, we might need to add a few more tracers to that team. But we hope that no one ever gets a submission and that the phone never rings.
Right, but we know it will. What just to put it out there, your website is communitycounter.org, right?
That's correct. Yep.
Okay. Now, one of the reasons why you want to get this out right now is because Rosh Hashanah is coming up. So there's a large chance of a lot of people getting together, right?
Mm-hmm. Yeah, that's right. And also the schools are opening.
Yeah.
The schools have been really an interesting sort of forefront of the public health conversation right now. And so hopefully everything that people have put into place will allow for total safety. But we wanted this program to be available in advance of Rosh Hashanah, Yom Kippur, and also the schools opening their doors.
Yeah. Now, so one question people may ask is, do you provide the data that you collect to the public health authorities?
We do not. Nothing that we receive in our forms gets fed to any public health authorities. But the reason that we have endorsements from several public health departments is because one of the things that the contact tracers will do when they are on the phone with individuals who may have been exposed or affected is they're really going to reassure them that the public health contact tracing efforts are safe and anonymous and really critical to the suppression of COVID. And the public health departments like the idea that people embedded within the community will be delivering this message because there's a lot of fear of contact tracing. It's perceived as government surveillance, and obviously surveillance has a negative connotation. So we are trying to be sort of a bridge in terms of how we train our contact tracers to talk to people. We want to be a bridge to the public health department.
Yeah.
We are not feeding them our information, and they cannot see what we receive.
So, but it's still, it's effective in helping the community by letting people know that they've been exposed so they can take the proper precautions.
Exactly.
Yeah. Now, how do you intend to be able to use this model to be duplicated through other communities that may be, have more insular and have large gatherings where it's part of their culture?
Yeah, there are a lot of communities like that. And we hope that this whole concept and even portions of the website itself can be exported for use in other communities. I know that there are other religious communities where the Zoom platform has not lent itself well to the way that they like and need to pray. And those communities have started to reopen. And so we are looking at, offering them this platform and this service. And there are other pockets of our society where there's a lot of insularity and there's a lot of gathering, but a lot of resistance to talking to the government, to the public health departments. And so we are hoping that this model can be adapted by them to meet their own needs.
Are you aware of any other organizations like this?
Not with the specific, I'll say, selling point of an anonymous self-report. I think that there are other organizations, even within Chicago, there's one called Cogent, where you are asked to input your phone number and your address, and this will allow the contact tracers to do a full assessment beginning with the primary patient. But we wanted to offer an additional resource to the community where people could provide this information with the starting point of their own anonymity and confidentiality being protected.
And this, I think, could also be used for other types of, future diseases, or, there's been measles outbreaks and different types of things in the Orthodox community. And it, do you foresee that happening where it becomes, transforms into a larger process?
I think it really has the potential for that. That's something that I've explored with the public health professionals that I've worked with. This is a model that really marries the need for community-based engagement with a larger public health approach. And so I think for other illnesses and yeah, unfortunately, we will be met with other illnesses post-COVID that are very contagious and that spread in a way that could cause a lot of stigma. STDs are one of them. You know, measles is certainly a contentious issue. And yeah, I think that this model could have a lot of mileage in the public health sphere going forward.
Yeah. Well, I applaud what you're doing, and I think what's interesting about this time period that we're in is that everyone needs to think of how to reinvent themselves, how to be creative in order to be of service to the public good. This is not your background. You're not an epidemiologist,
No.
um, but you just thought of how can I help myself, my community, my world. And this is, you got to start hyper local to get there.
Yeah.
So I applaud that. Are you looking for donation support, or is it more volunteer and spreading the word right now?
Everything that we are doing is volunteer based. We are not looking for donations. We are looking for spreading the word, because the website is only as effective as its use. So we really want people to know that this is out there. We really want people to feel comfortable with this platform and to think of it as part of the checklist of what they might want to do if, God forbid, they learn that they are positive for COVID, that, they need to figure out a lot of things about how to how to go through the quarantine process and get wraparound services for meal deliveries, etc. But we're hoping that this can be part of the checklist of, okay, I have this diagnosis and these are the few things that I need to do to get my ducks in a row.
Yeah. Well, just to remind everybody, the website is communitycounter.org. Manya, I thank you for doing this, and I hope that this helps spread the word. And hopefully nobody ever needs to use it, but we know people will, and I think it could be a great model to help many people throughout Skokie and Evanston, throughout the entire world. So thank you so much for being here today and taking the time to speak with me.
Thank you for having me. It was a pleasure.
You're welcome.